I'm Gene Kuleta, editor of the Latin America Advisor at the Inter-American Dialogue in Washington. Latin America has become an epicenter of the COVID-19 pandemic, particularly in Brazil, which has more than 1 million confirmed cases of the disease and more than 50,000 reported deaths, second in both categories only to the United States. However, the companies most involved in developing a vaccine are located in the United States, Europe, and Asia. This has led to concerns about so-called vaccine nationalism, that is, that countries would seek to immunize their own populations first and potentially ban the export of a future COVID-19 vaccine. To discuss what this means for Latin America, we're joined today by Arachu Castro. She's the Samuel Z. Stone Chair of Public Health in Latin America at Tulane University, and she joins us today from New Orleans. Thanks so much, Arachu, for joining us today on this important topic.
You're very welcome, Dean.
As we discuss vaccine nationalism, can you tell me, from your viewpoint, how much should Latin America and the Caribbean worry about vaccine nationalism?
Well, Latin America and the Caribbean is a region that should be worried because, as you mentioned, it's not in the top of the list of regions that are developing vaccines. However, the most important institution in the region is Fiocruz in Rio de Janeiro, which has a long tradition of responding to infectious diseases. And it has been designated by the World Health Organization as the regional institution that is going to collaborate with countries with other countries in the region to share any advances that are made to the development of a vaccine.
When we look at the topic of vaccine nationalism, how much has this been a problem or an issue in the past with past pandemics, countries or companies seeking to keep the vaccine for themselves, trade barriers, things of that sort, export bans? How much is there historical precedent for this?
Well, there's a very important historical precedent in many infectious diseases, and such as multi-drug-resistant tuberculosis, where there was a mechanism that was created actually to be able to do a pool procurement of medications to treat patients with multi-drug-resistant tuberculosis. We have another case that most people will be familiar with, which is the HIV epidemic. And for this, there have been lots of problems in accessing life-saving antiretroviral therapy in many countries around the world. For example, South Africa had a huge issue accessing certain medications because of the patents that pharmaceutical companies had. And that was a case where clearly the motivation for profit became ahead of the health of the population. So we have reasons to be concerned that something like this could happen, but luckily there are several international mechanisms that are trying to prevent that from happening. One of them is the solidarity call to action that has been promoted by the government of Costa Rica in partnership with the World Health Organization, and that has been endorsed by several countries around the world, many of which are in Latin America and the Caribbean. And it calls for the voluntary pool of knowledge, intellectual property, and data related to the pandemic. So that is one. Another very important initiative is the global movement for sustainable health equity, which is working alongside the World Health Organization and the United Nations Secretary General to create a global health equity task force based at the World Health Organization to promote a rights-based response that also, very importantly, demands the abolition of patents or any other technology that will respond to the pandemic. This is a very important call. I'm one of the signatories of this call, of this movement, and this is a time for pharmaceutical companies to show how they actually care about corporate social responsibility and about the role that they have in promoting discovery, but this is not some heads of certain pharmaceutical companies find these international strategies ludicrous because they think, well, we're driven by profit. Yes, it's fine that you're driven by profit, but to a certain extent. This is not the time to put profit ahead of the needs of everywhere in the world, everybody in the world who could most people around the world have lots of issues accessing healthcare and living quality lives and be able to survive for as long as we are capable. However, this time the pandemic is highlighting all the issues that are wrong with limited public spending on healthcare, and particularly in Latin America, where there are different types of healthcare systems, but most of the times they are segmented, except for Cuba, which is the only country where the private practice of medicine is not allowed. In the rest of the region, most countries have, in addition to a private healthcare system, they have either a unified public health system, such as in the case of Brazil or Costa Rica, and then there are countries that have segmented systems. Mexico is a very clear example because it depends on where people work, they may have access to certain type of care. And those are usually through social security mechanisms that are based they're attached to employment. So already in those countries where they have all these different public spending going to different mechanisms to provide healthcare, the response is lacking coordination. But of course, they are also, what this pandemic is showing is that even in countries such as Brazil that has a unified health system, the lack of political priority to respond to the pandemic is creating a huge amount of devastation that could be prevented if there were better coordination mechanisms to respond to the pandemic.
Do you think that investing more in development of vaccines is something that needs to be more of a priority in Latin America for governments or for companies that are based in the region?
I think that there should be a lot of investment in public spending in healthcare. That includes vaccine development. And I do think that while there is a development of the vaccines, some this week were announced that may be able to start to be distributed in the fall, it's going to create a lot of inequity, the access to the vaccines, particularly if certain countries implement the vaccine nationalism, which is to provide the vaccine first to its own citizens. And there are companies that have factories throughout the world that may help avoid that vaccine nationalism to some extent. There certainly should be more investment in science and including in medical technologies, but I would emphasize the need to invest in public funds in public health care, which would benefit millions of people throughout the world. And in the region, it would be very important. Most of the times, primary healthcare systems, we should be the core to reach out to the population and to respond to the needs of the population, are underfunded. And there's more money being channeled to hospitals instead of strengthening primary health system. And that does not necessarily better respond to the needs of populations.
All right, terrific. All right, Arachu, I think that's all the questions I had for you. Thank you so much for joining us on this important topic today.
You're very welcome, Gene.
Arachu Castro of Tulane University joining us today from New Orleans on the subject of vaccine nationalism. I'm Gene Kuleta, editor of the Latin America Advisor at the Inter-American Dialogue in Washington.